Thanks to everybody for coming along. So today is a very special day because we have with us here Sheila LeBlanc, who's come all the way from California. And Sheila is the daughter of Constable Albert Alexander, who was the first patient ever treated with penicillin. And we've had a very exciting few days. We've visited Newbury, where Sheila's father was buried, Wootton, where the old family home, the police house, was located. We went to the Dunn School of Pathology in Oxford, where the penicillin purification work was all done until enough penicillin was ready to treat Albert in hospital. And we also visited the old Radcliffe Infirmary, where Albert spent his last days. I think that the best part of the trip so far, as based on the smiles, I think was stopping off at the T-Bay farm shop on the way to Glasgow, where I think gluten-free Scotch eggs have now entered the vocabulary. So what we're going to do today is just give a presentation from Ashley Stevens, who's a very great enthusiast about the Oxford part in particular of the Penicillin Story. Ashley is actually a chemist by training, but has spent most of his career working around IP issues and spin-outs, and actually became closely associated with CARB-X, which is currently the great clinical antimicrobials funding agency based in Boston, where Ashley is himself based at the moment. Ashley contacted me when I published a small article about Sheila's story because of his own interest in penicillin. And Ashley has very kindly agreed to come all the way to Glasgow from Boston to share with us his knowledge about the penicillin story. So, Ashley, would you be so kind as to come and tell everybody about this extraordinary story which really began the world of antimicrobials, and let's hope that it really was the first of a sustained beating of the microbes rather than a transient blip in human history and its fight against the microbes. Ashley Stevens.
Thank you, Michael. And I want to thank the World Congress. I had the pleasure of speaking at the 18th Congress in Kyoto, and it's a pleasure to be back here in Glasgow. So Michael has positioned, and I put my degree up here so that you knew the direction from which I was approaching this story, a direction that may not be popular 40 miles from Alexander Fleming's birthplace, but I just want you to know where I'm coming from. So the Penicillin Story is the story of 4 people. 3 of them are really kind of interesting. We have Sir Alexander Fleming, a great scientist. He did great work in the First World War on treating wounds. He was one of the worst scientific communicators you ever came across. We have Lord Howey Florey, the Australian, another interesting character. He could not praise anybody to their face. He could only be very dismissive while lauding them behind their back to others. He married a beautiful Australian woman who was deaf. They finished up communicating in writing. We have a long letter from him to her complaining about their marriage and the lack of sex and things like that. An interesting man. We have Ernst, a German Jewish refugee from Hitler, who believed in the German system where the lab chief was God and was not questioned. And that led to great difficulties with Norman Heatley, the 4th member of the team, who a lot of Florey's charm was put into managing the relationship between Heatley and Chain. And Sir Henry Harris, a later professor of medicine at Oxford, characterized the relationship between the four as follows. Without Fleming, no Florey or Chain. Without Florey and Chain, no Heatley. Without Heatley, no penicillin. So the story starts at St Mary's Hospital Medical School in London. Fleming worked in the inoculation department, which was a kind of independent fiefdom within the hospital. And he discovered penicillin in 1928. He was working on staff at the time, and a plate got contaminated. He said he came back from vacation and found a plate where staff had been killed. That just wasn't feasible. He kept bad lab notebooks. He did photograph the original plate, and we have that photograph. He didn't say how he discovered penicillin until 1944, and he thought it was just another enzyme. It turns out to be penicillin notatum. His colleague said it was penicillin rubrum, but was wrong. He showed the antibacterial effect in vitro against multiple pathogens. He was unable to stabilize penicillin. Its efficacy decayed in a week, even when refrigerated. Tested the toxicity in a rabbit, not toxic. Tried it topically on a woman with septicemia in her leg, no effect. His collaborators, Ridley and Craddock, weren't chemists. They managed to purify it 10 to 50-fold, but they couldn't stabilize it. And he never did in vivo animal experiments. Gave a presentation to the Medical Research Club. This is a discovery that later got the Nobel Prize, and his presentation was so bad that he got no interest from the audience, not a single question asked, and nobody wanted to collaborate with him on it. And he published in the British Journal of Experimental Pathology in 1929 and ceased working on penicillin in 1932 and worked on sulfonamide drugs from there on. Now we detour to the north, to the Royal Infirmary in Sheffield. And there was a man called Cecil Payne, who was an undergraduate at St Mary's, knew about Fleming's work. When he got his BS in 1928, he moved to the Royal Infirmary as a laboratory technician in the pathology department. He later got his MD, and in 1930, he got some penicillin cultures from Fleming, and he worked with Royal Infirmary clinicians to test the drug. They successfully cured babies with gonorrheal infections and pneumococcal eye infections. They never published or presented their work. They only had a crude extract to test. He joined the Jessup Hospital in 1931 and studied puerperal fever for the rest of his life. And, as you might expect, he bitterly regretted not having followed up on his findings. Now, here's the possible link between Fleming and Florey. Florey became chair of pathology at the University of Sheffield in 1932, and Payne told Florey about his work. Now we move on to the Oxford period, the Sir William Dunn School of Pathology. Florey was editor of the British Journal of Experimental Pathology, which had published Fleming's work. And he was appointed professor of pathology at Oxford in 1935, so 3 years in Sheffield. And he hired Ernst Chain, a biochemist, and they studied lysozyme together, another Fleming discovery. They showed it was an enzyme, they isolated it, they determined its mechanism of action, and found it, unfortunately, only attacked benign bacteria. Now, both Florey and Chain were interested in bacterial antagonism. Florey had written a review of it in 1930. And Chain started an exhaustive literature search. He found 200 papers, including Fleming's paper, which was fortuitous, because Fleming had published in a pathology journal, not a pharmacology journal. That was in 1938. They thought it was an enzyme, similar to lysozyme. Another lab had a culture of Penicillin notatum, and they started growing it up in September of 1939 and started repeating Fleming and Raystrick's work. They decided to study all known bacterial antagonists, and they generated a short list, Bacillus paracyanus, Bacillus subtilis and mesentericus, and Penicillin notatum. They picked Penicillin notatum, as we know. And it appears to have been a joint decision, although Chain later claimed it had been his idea. And the big question in my mind, which we will never answer, is in that room, when they were deciding what to go with, did Florey remember his conversation with Cecil Payne and the efficacy that Payne had found? We'll never know. So they had to fund the work, and they got funding from the Medical Research Council and the Rockefeller Foundation. MRC's total funding was £1 million for 5 years in 1934. And their initial grant to Florey for this was £25. And the total Dunn School funding then was £1,200 a year, and I think £800 went to penicillin. They applied to the Rockefeller Foundation, $5,000 a year for 3 years. And then they applied to the Nuffield Foundation, which gave them £300. That allowed them to hire Margaret Jennings, who worked in the lab, and Florey's relationship with his wife had totally deteriorated, and Margaret Jennings and he became lovers for many, many years, and when Ethel Florey died, he married her. The initial development, Heatley took over improving the fermentation. He first created a fusion assay to measure its antimicrobial activity, and Chain worked on extraction. He showed it wasn't an enzyme, extracted it into ether, and in 1940, Heatley had the breakthrough that enabled them to extract and stabilize penicillin. Based on its acidic nature, he extracted it from the broth into ether, and then from ether into alkaline water. Chain poo-pooed the idea and resented the fact that the man who worked for him came up with something and did it that he disagreed with, but it worked. It did exacerbate the problems between Chain and Heatley. Heatley did the scale up. Here are these bed pans they used to grow it in, surface fermentation. And he developed a continuous counterflow extraction system. He was incredibly ingenious. And his second generation version cost £5 of materials he could scrounge together in wartime Britain. And he freeze-dried it to get a stable brown powder. They did their first mouse tests in March 1940, no toxicity. And they found the mouse's urine contained penicillin. And that was massively important because it showed that it was stable in vivo and therefore a potential drug. First in vivo demonstration of protection was in May of 1940, the start of the Dunkirk evacuation. This was all going on in the heart of warfare. And they tested against strep hemolyticus. They had 4 mice treated and 4 untreated controls. All the treated lived, all the untreated died. They repeated 2 days later with 50 mice and triple the dose, and 24 treated lived, 1 died from another cause, all the untreated died. And there was an initial article in The Lancet in August 24, 1940, when the Blitz had started. There was still doubt that fermentation could supply commercial use. Fleming read the Lancet article and came to Oxford and said to Florey at the end, "It only remains for your chemical colleagues to purify the active principle and then synthesize it." So the first human trials in the Radcliffe Infirmary in January 1941, they gave it to Alva Akers, a terminal cancer patient, to look for adverse effects. There was a pyrogenic response. Florey found it was caused by impurities, and they repeated with a more highly purified batch, and there was no problem. Then we come to Sheila's father, Constable Albert Alexander. Oxford policeman, father of Sheila and her brother, cut near the mouth in a bombing raid in Southampton. It turned septic, and the story that I grew up with, that he scratched his nose on a rose bush in the police station garden, Mike, in his research, showed was apocryphal. He got very sick. A sulfur drug was tried. It caused a rash, but no improvement. He was given penicillin on February 24th, 1941, immediate improvement. They collected his urine and re-extracted the penicillin from it because they had no further penicillin available, because the second patient, Arthur Jones, had started treatment 10 days later. Albert relapsed and died on March the 15th, and Arthur Jones lived. He was the first person whose life was saved by penicillin. So they couldn't get any British company to help scale up. They decided to get US help. Florey and Heatley flew to the US, which was no mean challenge in 1941. The big book on penicillin is called The Mold in Florey's Jacket, because they sewed it into his jacket that he wore for the plane flight. That was in June 1941. They went to the USDA Northern Research Laboratory in Peoria, Illinois, which had developed a submerged fungal fermentation for gluconic acid production, using corn steep liquor, very rich in nutrients. That was in 1935. They had to isolate a new penicillin strain better suited to submerged fermentation, and they got it from a moldy cantaloupe melon from a local market in Peoria. And it was a Penicillin chrysogenum notatum. And it produced penicillin G versus penicillin F. And they developed the submerged fermentation process for penicillin. They met with Alfred Richards at the University of Pennsylvania, who was chair of the US Committee on Medical R&D. And Merck and Squibb agreed to collaborate on the scale-up, and Pfizer joined later. First American patient was treated in March of 1942, Ann Miller at Yale Hospital, and she had a complete recovery. By January 1942, the Dunn School had more penicillin. There was enough to treat 15 systemic infections, 172 localized infections. And Florey put his wife Ethel in charge of the testing. She was a doctor. And she concluded that she had to have enough to treat the entire infected area of the localized infections, and to keep treating till well after an apparent full recovery to treat systemic infections. So the British tradition was of pure science and no academic involvement in the commercialization of the science at the time. And it lasted quite a while into my time as a DPhil. And attitudes were similar in the US at the time. Chain, whose father had been a chemist in Germany and hence understood the power and importance of patents, argued for patenting. He pushed for them. And Sir Edward Mellanby forbade it. He was secretary of the Medical Research Council. And in one of those beautifully subtle pieces of anti-Semitism he told Chain that if he persisted in his money grubbing, he would have no scientific future in Britain. And cornering of penicillin was to be avoided at all costs. Mellanby obviously did not understand that a patent gives you the power to control the development of your technology. It does not oblige you to make a monopoly of it. In Peoria, Andrew Moyer was a staff scientist at the USDA in Peoria. They weren't allowed to get US patents. He was able to get UK patents in his own name, and the UK had to pay him royalties when penicillin went into commercial production after the war. We'll come back to that. The UK probably would have had problems if it had tried to patent penicillin. There were only two types of patent then, a composition of matter, and Fleming's 1929 paper would have been prior art against that. And also, the UK penicillin was penicillin F, and the US was penicillin G, with the double bond moved round one position. The production method, obviously, Heatley only did surface fermentation, and the USDA developed the commercial submerged fermentation process. The UK could have got a method of treating patent, but they weren't available then. And after the war, the National Research and Development Corporation was set up to patent British academic inventions in 1947 under the slogan, "Penicillin will never happen again," that we will not give up all our commercial rights. And indeed, NRDC and Oxford made good money from the cephalosporins, which were developed by Edward Abraham, who had been a junior member of the penicillin team. So Fleming and Florey were knighted for their work in June of 1944, and as I showed, Florey was subsequently ennobled. They got the 1945 Nobel Prize, which was £8,500 back then, shared equally. Fleming, Florey, Chain, and the Nobel Prize rules only allow 3 winners, and so poor Heatley drew the short straw, although, as I said, Harris felt that without Heatley, we would not have had penicillin. He wasn't even elected in FRS, considered just a pair of hands. Oxford understood and awarded him its first ever honorary MD in 1990, which I think was a nice recognition. So, who really discovered penicillin? Fleming undisputably made the initial observation, but it was an accident, not even a surprising result of an intelligently designed experiment. He thought it was another enzyme, just like lysozyme, and if so, it would have been useless as a drug until recombinant DNA came along and allowed us to make protein molecules in large quantity. He never pursued it further. His strain of penicillin wasn't practical. He never did any in vivo evaluation, even in mice. Payne did his work independently of Fleming and also abandoned it. It was the Oxford team, in my opinion, that made penicillin into a therapy. And as I said, did Florey recall something about Payne's work when he and Shane were deciding to work on and picked penicillin? It was the Oxford team that realized it was a stable small molecule and hence could potentially become a useful drug. They created the first mass production system and made enough to do the initial clinical testing and got the US to scale it up. Fleming lobbied shamelessly for half the Nobel Prize, and the Nobel Committee got it right, thirds. So how did he get so much of the credit? Well, in August 1942, Fleming called Florey begging for penicillin for a close friend, Harry Lambert. He had a streptococcal infection and was desperately ill. Florey agreed, gave Fleming all the penicillin they had, and Fleming successfully treated Lambert. And the Times reported on the success, and this got the attention of Sir Almoth Wright, a former head of St. Mary's Inoculation Department. He wrote to the Times crediting Fleming, and reporters rushed to St. Mary's to interview him. Now, Sir Robert Robinson, professor of chemistry at Oxford and a future Nobel laureate himself, wrote to the Times crediting Florey. So the reporters rushed to Florey. He refused to meet with them. Lord Moran promoted Fleming. He was Churchill's personal physician, probably the most eminent physician in the UK at the time, and, as it turned out, a former dean of St. Mary's. And he wanted to use penicillin to ensure St. Mary's survival. And it did survive until 1988. The Daily Mail promoted Fleming, Lord Beaverbrook. And the MRC refused to issue a statement correcting the record. And St. Mary's did indeed launch an appeal in 1944. And I think the final reason why people accepted Fleming so easily, I go back to the first photograph I put up. Fleming absolutely looked the part of the benign, studious, bow-tie-wearing academic doctor. He lived in London and hence was much more accessible to the press than Florey was up in Oxford. So that's my account of the history of the development of penicillin, very much slanted from the perspective of the Oxford contribution. I did my DPhil in the laboratory next door to the Sir William Dunn School and used to pass it each day. So thank you for listening. And Mike, I got it done in the time.
Ashley, you've absolutely shamed me. I looked at Ashley's slides yesterday and assured him he had absolutely no chance of doing that within 25 minutes, and he's done it within 15. And I can also say that was exceptionally lucid. He's given us absolutely the Penicillin Story in a fantastic potted summary. That was amazing. And I would only disagree that Fleming wasn't a bad guy. He was definitely shy. I think it was all Almoth Wright who fought for the credit because he wanted St. Mary's to profit directly from it, and he did extremely well. But I'd also say it is terrible that Heatley wasn't rewarded with the Nobel Prize for his efforts. He was, as Henry Harris said, no Heatley, no penicillin.
Yep. And the loveliest man. I mean, of the four of them, he was probably the one you would want to go out and have a beer with.
Anybody have some questions for Ashley? If not, we can perhaps take a few questions at the end. There's just, before we move on, there's just a few little things I would like to do as well.
So I said that Merck and Squibb and Pfizer were the initial licensees, co-developers. So penicillin was made by multiple people, and its price never escalated, never skied. The next antibiotic to come along was streptomycin, discovered at Rutgers and partially funded by Merck, who had the exclusive rights. And Waxman realized that Merck couldn't make enough and asked Merck for the rights back so they could non-exclusively license it. And God bless George Merck, he gave them back. And again, streptomycin was never high-priced. And it was the first antibiotic, aureomycin, discovered by American Cyanamid in the private sector that was a monopoly, and that the price escalated, and that led to the first of the many, many discussions we've had since on the price of drugs.
Ashley, thanks so much. So I just want to just really end up here with a few comments on the legacy of that first patient, Albert Alexander. I think the Penicillin story is very, very wound up as a story of war. And Ashley already commented that in May 1940, the British Army and their Belgian and French allies were stranded on the beach at Dunkirk. And to all intents and purposes, as the Nazis had blitzkrieged their way through Europe, really things looked grim. The British Army was there for the taking, and had they been taken, Britain would have been undefended and the war would have been lost in 1940. I think we know now that that didn't happen, and there was the heroic evacuation of the beach with some help from the weather that enabled many of the troops on the beach to get back to Britain, to reform, to regroup, and Britain stood to fight another day. But really, May the 26th, 1940, many people would have told you it was over. This is Norman Heatley. The same day that that evacuation began was, as Ashley told us, the day that he saw 4 mice treated with penicillin survive a streptococcal infection, whereas those that weren't treated died. Heatley, this wonderful, mild-mannered man, was so excited at 4 o'clock in the morning, he hopped on his bike and cycled through the streets of Oxford singing. And he was stopped by a member of the Home Guard who assumed he was drunk, something which I doubt Norman Heatley ever was. Perhaps if he'd had that beer with Ashley, he would have corrected that. Heatley woke up the next morning still so excited, he put his underpants on, back to front. He got back to work and was able to tell the others the result, and during the day those mice stayed alive. And it was at that point they realized they had something which cured a mammal of a bacterial infection and which could therefore potentially cure a man. Ashley has told us the story, the wonderful work done in Oxford, and again, heroic work, the penicillin girls working around the clock. They turned the Dun School into a factory. Heatley had introduced these sort of bedpans as the best receptacle in which to grow the mold, and 6 local women working 24/7 just grew and grew and grew the penicillium mold, harvesting the drug until Florey thought they had enough to treat a patient. And early in 1941, Sheila LeBlanc's father, Albert Alexander, was lying in the Old Radcliffe Infirmary, dying of bacterial sepsis. He was the first patient. Others had been given the drug to test its safety, again, as Ashley pointed out, but Albert was the first patient who received the drug with the intention of curing him. And the story was that Albert Alexander, turns out he was a very, very keen gardener, as Sheila's been able to tell us, had a beautiful rose garden at their police house in the village of Wootton. And the textbook story is that Albert cut himself whilst pruning the roses. And it was Sheila that told me that actually what had happened is that in November 1940, Albert had actually been seconded to Southampton, where the Blitz was attacking the docks there. Albert wouldn't have gone at all had not a colleague developed chickenpox just beforehand, and Albert volunteered to take his place. Albert was injured in a bomb attack, not a big injury, he had a small cut over his lip. The cut became infected. The infection over a few months turned into sepsis. He was returned to Oxford to the old Radcliffe Infirmary and was essentially dying when Charles Fletcher suggested to Florey that there was nothing to lose and everything to gain by trialing penicillin in Albert Alexander. This is a picture of Casablanca, and I got this picture primarily because the scale-up process that I actually refer to again involved Florey and Heatley flying to the States on the old Clipper plane via Portugal, which is exactly that plane behind Humphrey Bogart here. And again, as Ashley told us, there's a great book that tells us that Portugal at the time was neutral. It was full of Allied and German spies, and there was a real concern that if they'd taken vials of the mold, it could have fallen into the wrong hands. So they impregnated the lining of their coats with spores of the mold and resurrected them when eventually they got to the United States. And it was in the United States, again, as we've just heard, that an extraordinary, incredibly rapid process of scale-up came into play. And by the end of the war, by 1944, by D-Day, the Allies were being treated with penicillin, and the wounds that had hitherto killed a disproportionate number of servicemen were healing. Many people think that this shaved at least a year of the Second World War. In fact, somebody asked me, what is it about Albert Alexander in particular? And it's true that had not Albert been the first patient, somebody else would have been. But just think of the timescales here. 1941, first patient treated. Didn't work, but he recovered sufficiently for them to understand if they could get that scale up, they could cure people. 3 years later, hundreds of thousands of servicemen were being treated with penicillin. Now, suppose Albert hadn't been there in February 1941. It had to be Oxford. That's where the drug was being made. How long would it have taken for the next appropriate patient to be there? 2 months, 3 months, 4 months. That gap could have changed everything. That gap could have meant it was almost impossible to get to the United States to encourage the Americans to produce those compounds. It could have been that there would have been no scale-up of penicillin before D-Day. The war could have extended. Millions more could have died. Albert, being where he was at that time, has saved so many lives. When Albert died, his wife, Edith, his daughter in the middle, Sheila, and her brother, Brian, were evicted from the police house. Edith had to go and work. There was no welfare state at the time. Edith couldn't look after 2 children. The children had to go into an orphanage. They kept in touch with their mum, but only got back together at the end of the war. In the 1950s, Sheila went to dances at the Corn Exchange in Newbury. And whilst there, she met an American serviceman, Lee LeBlanc, and they fell in love, married, and eventually went back to the United States, where Sheila, having actually married a serviceman, spent some time traveling around, has 2 sons and 2 wonderful daughters, Linda and Karen, who have joined us here as well today, and have lived now in the United States, most recently in California, really for the last 70 years or so. So we had a wonderful trip down to Oxford, Newbury and Wootton, and actually this is Sheila sitting outside the address of the old police house, and I was rather taken by the fact there's a great big rose bush growing right next door to that house, and I don't know whether that is a rose bush of some antiquity. But Sheila has come back here, and I think has really taught us something. Sheila lost her dad to a microbial infection. Sheila's dad was the first person to be treated with an antibiotic, and it wasn't enough. And today, we are reaching a point where, unless we're really careful, we may go back to a time where there are no antibiotics. People might die again from a cut on a rose bush or some falling masonry. And we can't let that happen. So I would just like to thank Sheila for coming here. And I would like everybody to also thank Sheila. And Sheila, if you don't mind terribly just walking to the front of the auditorium here, I would also like to see if Sally Davis, another amazing figure in our fight against antimicrobial resistance, if Sally, something I would like you to give to Sheila, and I would like everybody, when we do that, to give Sheila a big round of applause. If anybody does have any questions, Ashley will be very pleased, I think, to answer them, and perhaps even later today. It is, I think, an amazing story, and a story which hasn't ended yet. But just thank everybody for coming along. Ashley, in particular, thank you for that wonderful presentation, and Sheila, once again, thank you for being here. Okay, well, I think that's our session complete, and I hope that everybody who's at the conference continues to have a wonderful conference. Thanks for everybody who made it along. I hope you found it as interesting as I did, and keep the fight going. Thank you.